Right, well this follows on quite nicely from Philippa's. So, I'm going to ask, who here has heard of Innovate UK? Oh my God. How many people have got funding from Innovate UK? How many people would like to get funding from Innovate UK? Fantastic. Right, okay. Well, I don't really need to say any more. Actually, everyone knows who we are anyway, so that's fine. Okay, so my name is Chris Rowe. I'm the Innovation Lead for Medical Technology at Innovate UK. So, well, as everybody already knows, we are the UK's innovation agency, hence the clever name. We're here to support companies grow and scale. And, you know, it's not just the money. You know, we like to think about ourselves in various different ways. I like the inspire, involve, invest. So we're not just handing out money. We are trying to work with the ecosystem and sort of inspire people. And we are part of a larger organisation called UK Research and Innovation. So the EPSRC is part of that. There are 7 research councils, Health Research England and Innovate UK. We have, well, it's 8 billion, I think it's about £10 billion a year to spend these days, and that should be going up. Innovate UK gets about £1 billion a year of that to sort of spend supporting companies. Again, where we fit on the TRL levels, I mean, I don't particularly like TRLs, it's not the most useful way of looking at stuff. But the logic is the research councils tend to be slightly earlier stage, the more basic kind of research, although the organisations, the MRC, probably do a little bit more than that. Where we fit in and where, I think Ian's going to mention the NIHR next, is we work with companies who've got an idea, so we're not funding the basic research, it's more the translational space. It's when you've got a good idea, we will try and help you through what's called the value of the death, up to about TRL level 8. We don't do commercialisation, essentially, for sort of state aid rules, but there are things we can do around sort of real-world evidence. So we have a lot of tools in our toolbox. So this isn't my slide. My slide is much more complicated, and I realised nobody could read anything it says on it, so I've nicked this one from somewhere else. So the way we look at it, there are sort of 2 strands, I guess. One is around the sort of funding area, so this is money to companies. We also do support, I think what you might call the ecosystem side of stuff, so this is more sort of training, talent and skills. We do pitch training, that sort of stuff. We do some global activities as well. So, you know, we're here to try and sort of work with companies, evolve the ecosystem, so we can certainly spend money in that space. But I guess we're probably best known for our kind of funding activity. So this goes from grants, loans, investor partnerships, and procurement. So I'm going to sort of go through some of those quickly next. So here's that in a slightly different format. So funding and finance, obviously, I think a lot of you will be aware of the grant system we have. We have various options for that. The biomedical catalyst, I suspect most people will know about. That's probably going to be the most relevant to you, and I'm going to mention that in a minute. We have smart funding, which is kind of our large always open competition for anything in the STEM field, or I call the competition of last resort. If you can't find anything more specific to your area, which is what you'd like to go for, if you can't find anything, the smart's always open and sort of what you need to go for. We do innovation loans, and again, this tends to be more sort of latter stage. This is more for sort of scaling up and growth, not tend to be for the larger stuff. Obviously, a loan has to be paid back. SBRI procurement, so for those who know, Small Business Research Initiative, which isn't for small businesses, doesn't cover research, isn't an initiative, so it's completely wrongly named. But this is like a procurement process. So for the grant processes, we can only fund up to sort of 70% of costs for SMEs, with 100% funding for academics and NHS. SBRI is a procurement approach, slightly different, and it means we can do 100% funding. We don't tend to do a lot of stuff in that space in the medtech world. We do a lot of AMR and vaccines in that space, but it's not something we tend to use too much. And investor partnerships, and I'll mention that in a minute. We have lots of advisory systems as well. So we had something that's now called Innovate UK Connect, which used to be the KTN, Innovate Growth, which used to be Edge as well. So we have some other supports. It's around networking, connecting people. Innovate Connect Growth, now do a lot around sort of pitch training and stuff like that as well. Scale-up programs, and we do international stuff. We have a lot of centres and networks, the catapult centres, I think some of you will know about, knowledge centres, agri-tech centres. So we can help in that more sort of ecosystem area. We have knowledge transfer partnerships, future leaderships, and Women Innovate. So this is kind of small-scale funding to support that activity. And global, which I'll mention again in a minute. So we're obviously interested in global. I think the important thing to know, Innovate UK isn't part of the NHS. We're here to help grow companies. If you come to us and say, well, the NHS won't buy this, we want to go to America, that's fine, we're looking for a market. And if you say, we'll only sell a few of these to the NHS and nowhere else, then again, possibly not our area of interest. They're not mutually exclusive concepts, but again, we are here to look for scaling up and growing companies. That's our raison d'etre. So just to go through a quick summary of those. So Innovate UK Smart Grants, as I said, is the sort of always open grant. This is, if you can't find something more specific, that's the one to go for. And it opens and closes continuously. The biomedical catalyst, which I'm going to mention in a minute, investor partnerships and loans, small business research initiative. I put that up really just to remind people that there is sort of European money as well. There's a lot of, we are back in Horizon Europe now. They have a lot of pots of money. It tends not to be for small SME startup companies. It's where you have to work with companies around Europe and wider. So it's perhaps not the starting place, but certainly there's a lot of money in Europe, and we are back in that system. So just to give you an idea of what we spent, so this is for the last 2 years, 22, 23, and 24, 25. The spending in sort of healthcare area was 675 million. That covers things like catapults and things like that, so there's a lot of money in that sort of space. A lot around sort of the biomedical catalyst, and healthy aging. We also work in sort of the agriculture space as well, and we have some managed programs. We work a lot with the HSC around sort of vaccines and that sort of stuff. So I really just put up there to show we do a lot of different things. There is some real money in there as well. So I just mentioned the biomedical catalyst, which some of you will know. I've run the last one. I'm running the next one as well. And this is our sort of, I guess, our open sort of competition in the medical space. So we are slightly agnostic. We can look at anything in medical devices diagnostics. What we're really looking for is a healthcare challenge. So when we run competitions, that's what we're looking for. Again, this has been running since 2012 in various formats. We've got 150 million pounds to spend over 3 years. We've run 4 now out of the 6 programs we're going to do. So there'll be another one launching before or after summer, and then probably one again next year. And then we're going through a spinning review process, so we may get some more money to run the next one. And there are sort of, the biomedical has evolved over time. So we've got the traditional R&D program where we run a competition, you can apply, it's assessed by 5 independent experts. We can fund up to 70% of the companies, as I said, 100%. For academics, we can fund projects up to £4 million with a total project grant of £2 million. Again, I think it sounds like most of you are aware of that. What we're also doing is sort of getting into the investor partnerships. So this is where we work with the VCs. It's very clear that for a lot of projects, we can't fund you all the way to market. At some point, you're going to have to raise some money and work with VCs. So the logic is we try and help with that process earlier on. The logic being that we have access to lots of experts, key opinion leaders, who VCs don't, so we can sort of essentially de-risk, is it a good idea? VCs, as they'll tell you, always don't look at the project, look at the management team and stuff like that. So the idea is we basically de-risk it for ourselves. We fund half a project, the VC would fund the other half the project, and it means you've got sort of a VC connection early on, and hopefully that will help you through your process. We think the BMC is essentially, we're here to make you investor ready. That's kind of the logic behind it. So it's worth sort of speeding up the process with that. And then we're getting much more into sort of the accelerator feasibility side. The logic being, we will run these accelerators with perhaps a bit of sort of feasibility money at the end of it as a sort of closed, ring-fenced support for that. And I think this is the last more or less one. So again, we're looking at the global scale. So I was in Taiwan a couple of weeks ago. We took some experts out there to see how we can perhaps work with Taiwan in the future. So we're very interested in working overseas. And again, if you're going to start growing and scaling companies, most companies want to go to the US, but there is the rest of the world as well. But obviously, we want to be proactive in helping companies in that space. This really just sort of shows the process of what we go through. We start with sort of a scoping workshop. There are about 20 countries where we're interested in various different areas. And again, Innovate isn't just health. There's a lot of different things. We do a lot of agriculture in South America, and then we have the usual suspects, US, Japan, Europe, and that sort of thing. And then we do what we call a global expert mission, which is where we take 6 independent experts, which is what I did in Taiwan, and we go around, visit hospitals, visit the Ministry of Health, really just trying to understand how their healthcare system works, how procurement works, where their strengths are, and if we were going to do some competitions in the future, where we do that. We have something called the Global Business Innovation Platform, where we take companies overseas. So this isn't a sales thing as such. It's really about trying to find joint innovations, where we have some strength, where overseas have some strength. So I took some groups over to Las Vegas and San Francisco last year to sort of a health conference over there. We work a lot with the Texas Medical Center. So again, there's all these things where if you've got a more mature company, we can help sort of bridge the gap to different countries. We have incubator programs, and they're sort of bilateral things. So I ran a bilateral recently with South Korea in digital health. The logic, you have a sort of company and academic group here, which will work with a company and academic group overseas, and trying to find something which is mutually beneficial, where you both bring something different to the table. And I think that's it. So any questions? I'm sure we've got a chat in a minute, a round table at the minute. So there you go.